Hello, I'm David Kerr, Professor of Cancer Medicine at the University of Oxford. Welcome back, everybody from ESMO, the wonderful city of Barcelona. I was coming with an ESMO hangover, drenched in huge amounts of new data. One of the things I picked up on was a nice mini-symposium on gastrointestinal cancer led by Sara Lonardi, who made an excellent presentation picking out 3 abstracts in which she looked at molecularly targeted drugs, some early stage and a later stage study in which there's some evidence of promise. What she talked a little about were the preliminary results from 3 trials suggesting some benefits, pretty marginal, of cetuximab plus irinotecan in patients who'd already had EGFR receptor inhibitory treatment, amivantamab plus FOLFOX or FOLFIRI. This is a bispecific antibody against EGFR and MET. Again, very early days, but some potential marginal benefits coming through. And the results of a larger phase 3 randomized trial with an old friend ramucirumab, the anti-angiogenic agent, in which the ramucirumab in combination with Lonsurf failed to meet its primary endpoint of improving overall survival. But there were some interesting post-hoc subgroup analyses showing potential benefits in women, left-sided tumours and so on. So she made an excellent presentation which she summarised by saying the future of colorectal cancer treatment lay in further defining molecularly targeted treatment. Nobody would disagree with that. What is interesting, though, is that the more we, if I were to use an analogy of mining, the more deeply we mine, perhaps the more marginal the benefits are becoming. There's no doubt that we are understanding better the exquisite machinery of cell signaling. We understand that there's redundancy, there's repeatability, the possibility of emergence of resistance can come quite quickly. So although we can develop ever more precise molecularly targeted drugs, it does seem as if the clinical benefits of these, in some cases, are marginally small. What I'd like to suggest that in addition to Sara's cure for more molecularly targeted drugs is to think about cellular targets. We're doing a lot of work, as and many others, of course, looking at the immune tumor microenvironment and trying to, in a way, separate and understand the contribution of the individual component cells, of which there are many, cancer-associated fibroblasts, NK cells, whole hosts of different types of T cell subsets, B cells, tumor-associated neutrophils, and so on, and how these interact together, and of course interact with the epithelial colorectal cancer cells. We're collaborating with a chap called Patrick St. John, clever chap, who believes that combination immunotherapy, dissecting and understanding the individual role of these different cells and coming up with either cellular therapies or targeted therapies that either inhibit or stimulate some of the different cell components could be the way ahead for an immunologically cold tumor like microsatellite stable colorectal cancer. So, for example, we're looking at combinations of our HDAC inhibitor, which switches on the machinery of antigen presentation, upregulating MHC class 1 and class 2, some other of the molecules involved in antigen chopping and presentation. If you like, turning a microsatellite stable immunologically cold tumor hot, an IL-15 superagonist that stimulates NK cells. We found a way to manipulate and reduce the number of Treg cells. We have various approaches to reducing the microenvironment transforming growth factor beta and some of the downstream elements from that. And by seeing what we can look at combinatorial immunotherapy, but thinking at a cellular level and developing anti-cancer agents, which either activate or inhibit these different cell components. So I'd bring the two together. Of course, the future has got to be better molecularly targeted drugs, but let's think at a macro level as to how we can look at the different cellular interactions within the tumour microenvironment, and perhaps through that come up with synergistic immunotherapeutic combinations. Thanks for listening. I'd be really interested in any comments that you might have. But for the time being, Medscapers, over and out. Thank you.